MHA, the Mental Health Association of Nebraska, is a non-profit, peer-based organization that is more than an organization. MHA is family.
Working with peer support and the Mental Health Association has really helped me find the best things about myself and help me utilize my lived experience to make a difference in my community.
Whether you are dealing with substance issues, mental health issues, or have been incarcerated in the past 18 months, MHA will do all that it can to assist you in finding wellness, recovery, and overall your purpose within your life.
I would say MHA has helped me. Helping others helps myself the most, so I would say it's helped me in doing that. It's also helped keep me in recovery. It's helped keep me recovery focused. It's helped me by allowing me to help other people find recovery or maintain recovery. And then it's allowed me to get to see other people grow, and I get to watch their recovery.
MHA is a peer-based organization.
So intentional peer support to me is not only using your own lived experience to relate with somebody, but also you have a purpose behind your relationship. You have a purpose behind the connection that you are trying to build with somebody, and that you are trying to understand where they're coming from, understand their own worldview.
MHA will advocate for you. We will fight for you, but what we won't do is take away or dictate your choices.
You know, the intentionality, it just runs through everything we do. You know, there's purpose behind the things we do. Even though sometimes peer support might look different to people who haven't experienced it, there is intentionality in it. And we, again, follow people's leads. We're not telling people what to do. We're, helping them with a RAP plan that is encouraging them to take action.
MHA believes that no man, woman, or child should ever be left behind. Just a quick synopsis of a few of the many programs are:
HomeB.A.S.E is a hospital diversion program. It's a respite that you can come stay at when you are having troubles with mental health issues and or substance use issues. It's a 5-night stay. The purpose is to hopefully prevent the usage of higher levels of care, such as the hospital, the crisis center, avoiding jail, relapse, that type of thing.
HomeB.A.S.E is for people coming out of correction. We try to help people get established with housing, job, just sort of get their feet on the ground. Most of the time within 90 days, sometimes a little bit shorter and sometimes a little bit long. We try to get them set. We have people in the MHA, the whole program that helps them with the employment if that's the way they choose, if that's the way they want to do it, or they can find it on their own. And we also have somebody with the real program that helps them with other things like clothing and just other stuff to help them on their way. And then we support them through the 90 days or whatever time they're here, and through peer support, and that's what we do.
What I do is I work for the HomeB.A.S.E program. It's the Higher Opportunities Through the Power of Employment, and we help people coming out of prison obtain and maintain employment. We offer application assistance, internet search training, resume building. We can do interview skills, problem solving. We can develop a transportation plan. If somebody's from out of town, I'll get on the city bus with them and ride the bus so they can learn where they're going to help get to work. We can work with personal appearance, assistance to learn the job. We also we help develop a work-life balance. And we do conflict resolution as well as wellness skills and job coaching. It's just a little bit of everything. Whatever we can do to help these individuals get a job and keep a job.
The REAL program was developed to help people in our community that were struggling with addiction, mental health, behavioral health, trauma, basically with just about anything. So The idea behind it was that police officers would go out on calls, they would encounter people that were struggling, and unless somebody was hurt or somebody was going to jail, their hands were tied and they would just have to leave. The idea came up with our program is that maybe we could intervene with that cycle. So they go out on these calls, they encounter these people, they send a referral to us, we go out and make contact with them and talk to them about what's going on with them in their life, what do they need to find wellness and to maintain in that, and then we help them on that course. And so the hope is that we will intervene with that cycle and they will find and maintain wellness rather than having the police come back out to their residence.
When we say benefits, we're talking about SSI, which is Supplemental Security Income, or SSDI, which is Social Security Disability Benefits, and work, and how work affects these disability benefits. There's a myth out there that if you go to work, you'll lose your benefits immediately, and that's not true. I was on disability benefits for about 7 or 8 years, and after coming to the Mental Health Association, I volunteered at the Kia House for a year, and then I started working part-time, and it was a very healthy place, and learning how peer support worked and working with my RAP plan, I was able to get healthier, and I decided to work full-time. But I worked part-time and kept my benefits for a long time. And I want to be able to share with other people that you can work and have your benefits for a long time. Work and benefits are not mutually exclusive.
HomeB.A.S.E stands for Bullying and Suicides Eliminated, and what we've noticed and what we can gather, in Nebraska, suicide is the first leading cause of death for youth, ages 10 to 14. And we know that it's the second leading cause of death for youth in Nebraska from ages 15 to 34. So that identifies a need in our community to support youth and really move towards prevention. And so really what HomeB.A.S.E aims to do is prevent bullying and suicide and implement a sense of community among the youth at the schools that we go to.
MHA is here to help you find your course back to wellness, recovery, and purpose again.
I love what I do. MHA has given me an opportunity to grow in my own recovery, which without it, I don't know that I would be where I am today. I've been given an opportunity to not only help others, but to help myself.
MHA is family.
My recovery is daily. It's a daily process for me. And like I said, some days are better than others. But if I didn't have the people that I have in MHA and the support that I have in the community, I don't know where I would be.